The symptoms, when one gets it, usually starts anywhere from 2 days to 14 days after being exposed. It is believed that the median period of incubation, where I may get the virus and may not manifest the symptoms, is about 4 to 5 days. Almost 90% of cases will manifest within 10 days after exposure. The symptoms typically will include a fever, and even fever, only about 70 to 80% show fever. There could be sneezing, upper respiratory symptoms, a dry cough. This may progress on to breathlessness after a week or so. You may also develop symptoms of severe body ache, chills, shaking, headache, nausea. Diarrhea may happen in 3% of cases. And we are realizing that this COVID-19 can present with a lot of unusual symptoms, including heart attacks and strokes. So it is believed that this virus, even though is a respiratory virus, spreads throughout the body and can have devastating consequences with regard to stroke or heart attacks, not just restricted to the respiratory system. It is also believed that this virus can cause certain other complications, including loss of taste and loss of smell. This is one of the typical features seen, even though there are certain other viral infections which can cause anosmia or loss of smell and loss of taste. If a person during this time develops loss of smell or taste with or without fever, with or without diarrhea, body pains and headaches, there is a strong possibility of COVID-19. This infection is transmitted directly from one person to another by coughing or sneezing through the respiratory droplets. The risk of the virus transmitting through fomites or inanimate objects is very, very small. So the paranoia about washing vegetables, the newspapers, milk packets, all is quite unfounded. It is majority transmitted directly from one person to another, which means if all of us wear masks, assuming that 80% of the population wear masks, and even if masks were effective only 60% of the times, it is very well possible that in 2 to 4 weeks, we can stop this pandemic. So that is why there is a huge insistence on the use of universal masking for everybody. In spite of all the developments which have been happening over the last several months, the only specific recommendations for treatment is symptomatic treatment with paracetamol and supportive oxygen when a person develops hypoxia. The hypoxia is also known as happy hypoxia or silent hypoxia because people don't realize that they are breathless till quite late in the course of the illness. That is why it is recommended that when you develop symptoms, you need to seek medical help to see whether there is a possibility that you are suffering from hypoxia, and we advise people to use pulse oximetry to check the oxygen levels. I want to reiterate that the pulse oximetry is not for healthy people. So there is no need for all of you to buy the pulse oximeter and keep checking yourself every day. This is only in people who are symptomatic. So people who are running temperatures, people who are having coughs, people who are having severe body pains lasting more than 4 or 5 days, they need to check the oxygen saturation to see whether the saturation level is more than 94. Anything above 94 is acceptable, and home isolation is what is recommended. If the saturation consistently starts dropping to less than 94, you definitely need hospital help and probably oxygen support. Apart from this, there are several agents which have been used, which include anti-clotting drugs like heparin, because it is believed one of the complications of COVID is that clots tend to form in the small blood vessels, especially of the lungs, which may affect oxygen transfer. So anti-clotting medicines like heparin. We also have started using steroids in certain cases where their oxygen saturation is dropping and they may require supportive oxygen. Such people, if steroids are given at the right time, then they seem to respond well. Apart from this, antivirals, there is only one which has so far been shown to have some benefit, what is known as remdesivir. This remdesivir probably shortens the duration of illness but has no mortality benefit. But this is the only one we have. all the other agents, including oseltamivir, including lopinavir, ritonavir, interferon, and even the favipiravir, which has been recently launched with a lot of pomp, has shown no significant benefit in treatment of COVID-19. So treatment is to ensure that you access care early so that if you require oxygen support, you can start it early. The idea is to have various means of oxygen delivery so that we avoid putting a patient on a ventilator. Once the person lands up on a ventilator, the outcomes can be poor. So we try to give oxygen in different ways to ensure that we can avoid putting the patient on a ventilator. We also try, as I said, anti-clotting medicines, steroids, and remdesivir if it is available. Even remdesivir is currently believed to be useful only in a trial context. It is not yet recommended as a treatment of choice. So these are the modalities. As far as prevention goes, the ICMR has recommended hydroxychloroquine as an agent to prevent infections in people, household contacts of COVID positive cases, or in healthcare workers who may be handling COVID patients. But there is very little medical evidence to say that this works. I'm still not sure whether the ICMR has robust data on this. There are a couple of papers, but I have my own reservations on the benefits of hydroxychloroquine in preventing the condition. Definitely hydroxychloroquine is not for the common public. It is only for household contacts of COVID positive cases and healthcare workers who are looking after COVID. The others don't require hydroxychloroquine. So what do we do right now? The only way to prevent or protect ourselves is to ensure physical distancing. As I told you, this is transmitted by respiratory droplets, which goes directly from one person to another within about 3 to 6 feet distance. Even though it can transmit through aerosols, in normal course of life for most public, aerosols are less likely. Aerosols are more likely to be a problem in hospitals where aerosol-inducing procedures are done for the patient, including nebulization. But for all practical purposes, it is droplet-mediated. So if you stay 3 to 6 feet away from anybody else, even assuming that they are asymptomatic carriers, I don't think you need to worry. On top of it, if both of you are masked, as I told you, masks are very useful, agents in preventing transmission of virus. In fact, masks are better if you wear a mask and you have symptoms to prevent the virus from being transmitted than others wearing masks to protect themselves. So if everybody is masked, I think there need not be any concern about this. Apart from this, avoid physical contact. Namaste is going to be the new normal. Whenever you cough or sneeze, do so in the crook of your elbow or your shoulder so that you don't splatter the droplets. And most importantly, frequent hand washing with either soap and water or an alcohol sanitizer, so that even if you touch inanimate objects, if your hands are washed after that, it is unlikely that you're going to transmit the virus to your face and then get infected. How do we diagnose this condition? The gold standard is the nasopharyngeal swab, which is taken for an RT-PCR test, which detects the genetic elements of this virus. This is the gold standard, but even this picks up the infection only 70% of the times. 30% of the time, this test may also miss the infection. We also have antibody tests, which become positive generally 10 to 14 days after the onset of the infection. So they are still not used for acute diagnosis and more often used for detecting how many people have been exposed to see whether they are safe for further exposure or at workplace. Recently, we have also had antigen tests, which are having a low sensitivity. In other words, the chances of picking up a diagnosis is low, but they are very specific in the diagnosis of acute COVID infection.